This is Group 1's presentation about traditional Chinese medicine. Traditional Chinese medicine is a set of medical practices that originated in ancient China. Traditional Chinese medicine focuses on the human body holistically, as well as the human body and its relationship with its external environment, and how the external environment in which you live can affect what happens internally within your body. Some of the key pillars of traditional Chinese medicine that we're going to focus on today in our presentation include acupuncture, herbal medicine, and Tai Chi. The focal point of traditional Chinese medicine is qi. Qi is an unseen energy that all living and non living things possess. Qi can have either yin or yang qualities, which exist in opposition with one another, but also in a balance. The yin or yang qualities that the energy possess give both non living and living things their traits. When an imbalance or disruption in qi occurs within the body, pathological conditions can result. In traditional Chinese medicine, these imbalances are prevented and treated using practices such as acupuncture and herbal medicine. Practices such as these target qi and the yin and yang qualities to restore balance and absolve pathological conditions. Acupuncture is the practice of inserting small, thin needles into strategic points throughout the body. Blockages of qi within the body can cause different diseases and illnesses. In traditional Chinese medicine, acupuncture is used to break up these blockages and restore balance of energy within the body. Acupuncture uses specific target points to break up these blockages. The target points are decided based on the pathophysiology of the disease. Acupuncture treats both the cause of disease as well as the symptoms. Acupuncture can be used for a variety of problems, but it is cited most commonly as being used to treat chronic pain. Food and herbal medicine are key points in traditional Chinese medicine. These practices focus on the yin and yang qualities of the things we put into our bodies and how that affects how our bodies function. In traditional Chinese medicine, each food carries its own energy, and it is important to have a balance of energies within the diet. Herbal medicine is used prophylactically and to treat illness. In traditional Chinese medicine, different herbs possess yin or yang qualities. Yin herbs have cooling qualities, while yang herbs have stimulating qualities. If an illness is caused by a deficiency in yin energies within the body, then herbs with yin qualities are given, and vice versa. Tai Chi is an ancient form of martial arts that has evolved over the years. Tai Chi incorporates mindfulness and physical exercise to improve health outcomes. Tai Chi is an exercise that consists of constant, slow movements. These movements possess their own energy, and the movements are balanced to maintain a balance of yin and yang. The movements in Tai Chi flow freely into one another to create a constant flow of energy. Studies have shown that Tai Chi can reduce stress, improve mood, improve aerobic capacity, and that Tai Chi can result in improved health outcomes. In modern day Taiwan, traditional Chinese medicine is still commonly used. Though Taiwan considers themselves independent from mainland China, many of the cultural traditions that exist there are tied closely to traditional Chinese culture. Clinics play the largest role in delivering healthcare in Taiwan. In a 2019 study that looked at the success of clinics in Taiwan, clinics that provided both traditional Chinese medicine and accompaniment with modern medicine were the most successful. This is due to the fact that many Taiwanese people still use forms of traditional Chinese medicine to treat a variety of conditions. Though not many individuals in Taiwan solely use traditional Chinese medicine, it is still used often and in tandem with modern allopathic forms of medicine.
Looking at some of the advantages of traditional Chinese medicine, it first can improve the patient provider relationship if the provider allows complementary treatment. The patient may come from a culture where TCM is prevalently used in care, so allowing the patient to use some aspect of TCM through their treatment can make them feel more comfortable. Um, Fortunately, it can be combined with Western medicine in most cases. For example, acupuncture. Acupuncture has shown a lot of success when used to help relieve pain. So it's not a real factor preventing lots of other treatments going on. There are also some disadvantages of using traditional Chinese medicine. One form of it, herbal remedies, can interfere with Western medicine, causing adverse effects when both are combined. They need to be studied further so there can be a better understanding on when to properly use them. And if the provider is not as accepting of the client's culture of wanting to utilize TCM, then there will be a barrier to treatment there.
Patient support and education. Healthy relationships between a patient and their physician are crucial to changing patient behaviors, achieving goals of treatment, and leads to an increase in patient satisfaction. Understanding the patient physician relationship can be beneficial to promoting collaboration between the two for a care plan. So, when a patient and a physician have effective communication, the likelihood of the patient's recovery increases significantly because the two are working together instead of against each other or alone. And the patient is able to understand what's going on in order to help make decisions about their care. Healthcare providers must be prepared to step down or take charge of the care depending on the patient's preference and educational level. So, if there's a patient who knows nothing about traditional Chinese medicine, there may be more willing to do whatever the physician tells them, whereas someone who does have a background may be more reluctant due to not understanding the treatments fully, or they may be more for it because they've tried it in the past. In either way, the provider must be aware of the patient's wants and needs in order to give them that appropriate care. And by educating the patient, that means the patient will be able to understand the treatments provided and make informed decisions about their care, which in the long run will need to be supported by their providers based on what the patient wants. Continuing along, physicians must evaluate patient expectations in order to treat and support their needs. Communication with patients reduces treatment discontinuity and doctor switching, which may result as a misunderstanding of, in this case, traditional Chinese medicine. So if a patient discontinues their treatment, they may not get better at all, or it may take the recovery process longer to take its effect. And doctor switching may also make the recovery process longer due to the new providers having to get caught up on the situation, speak to the past providers in order to see what treatments were recommended, started, what did and didn't work, and just to get a full understanding in order to help that patient. Um, Healthcare providers are encouraged to use effective communication skills such as attentive listening and open ended discussions. By using these skills like attentive listening, you are showing the patient that you do care about their health and you do want them to get better. And in the long run, that will help them trust you in order to help you help them. And open ended discussions, you get a lot more out of those rather than yes or no questions. So if a provider is to ask a patient, like, about a migraine or a headache that they're having, like, where does the pain hurt? And they just say my head, that's pretty obvious because it's a migraine, it's a headache. And if the physician says something like, can you tell me how often the pain is, where exactly it's located? Can you point to it on your head, like where it's located? Then that provider is able to focus the care onto that specific area and that specific problem. Whereas if they're only asking if it hurts and a patient says yes, that's not really going to get them anywhere.
The cultural competency goal would be to provide effective, respectful, and culturally competent care via gaining knowledge of different cultural beliefs, like views on various traditional Chinese medicine therapies, Healthcare providers illustrate cultural awareness via recognizing that in Taiwan, traditional Chinese medicine is viewed as an equivalent to Western medicine, and some individuals might prefer traditional Chinese medicine over Western medicine. Many Taiwanese individuals believe that Western medicine acts on a disease or illness faster, but is accompanied with far more adverse effects. Developing positive attitudes towards cultural differences, seeking education on various cultural beliefs, and interacting with culturally diverse groups. Healthcare providers can develop positive attitudes towards cultural differences by knowing their own cultural identities and beliefs as well as recognizing their own biases. When planning interventions or education, the patient's cultural views must be taken into consideration to provide culturally competent care.
All right, so TCM education for healthcare professionals. There are plenty of reasons people might practice TCMs. For example, there's the belief that TCMs are more natural and have fewer side effects. And because the balance of chi is important to those who practice it, taking allopathic medicine might throw off that balance with its side effects. For Taiwanese people who haven't fully assimilated to the US, cultural differences and a lack of understanding from providers might drive them to use TCMs. Cultural beliefs such as Western vitamins and medications to maintain health and treat disease is different from TCMs, and that clash in culture may drive Taiwanese people to use traditional Chinese medicine instead. Not being able to communicate with the provider might also be another reason for Taiwanese people to use TCMs instead of Western medicine. They could be too scared of telling the doctor the wrong symptoms or being too embarrassed of not being able to communicate with their doctor. So they might just not even go to a doctor at all. All right, how to provide culturally competent care for Taiwanese people and implementation of TCMs. It's important to get as much information as you can about their beliefs, about their disease, and the cause of it. For example, Taiwanese people might say they're lacking chi or energy, which could mean they're sick, since sickness is attributed to a lack of energy. And you don't want to miss a disease or a symptom of one because you just feel as though they're feeling less energetic than usual. Learning the different types of TCMs and how they compare to Western medicine might also be a good idea for implementation of practice. Obviously, TCMs are more important to those who practice it, so instead of just denying their use to the patients, knowing when they're good and bad can help the provider build rapport and trust while also easing the patient's fear and anxiety. So to implement acupuncture, there's a whole certification providers need to get in most states, but the overall gist of it is that there are 2,000 acupoints laid across your body on meridians, which are channels of chi. And when one body part is sick, that means there is a blockage or damage to that part of the meridian. And just like how everything needs to be balanced to stop the blockage, you treat the counter meridian. There are 12 meridians: the lung, the spleen, the heart, stomach, and so on. And each of the meridians have 5 other meridians, which can be used to balance the sick meridian. All right, implementation of TCMs continued. So herbal medicines are pretty iffy right now since there are so many of them and not much research has been done into proper use of like all of them and their side effects and all that. They also aren't as heavily regulated as prescription drugs are, so patients might be taking them without the provider's knowledge. So it's important for providers to know if a patient is taking any before treating them through surgery or prescription medications, because a lot of them have adverse reactions to drugs. For example, kava, which can treat anxiety and insomnia, can also have an adverse reaction with anticonvulsants and just increase the effects of them. Short-term use of kava is tolerated pretty well, but long-term use can lead to a lot of health complications such as liver damage. Implementation of Tai Chi is also recommended for healthcare providers since Tai Chi isn't as strenuous as other forms of martial arts and physical exercise, and because it uses slow and repetitive movements to put patients into flex stances and has them shift their body weights usually onto one leg. Tai Chi can be implemented for patients who are at falls risk or elderly and need to regain muscle strength and balance.
Evaluating traditional Chinese medicine implementation. Since the main goal of traditional Chinese medicine aims to restore the body's balance and harmony between the natural opposing forces of yin and yang, which can block qi and cause disease, evaluating its effectiveness would involve assessing relief of the target disease's symptoms. So for pain, acupuncture or Tai Chi can help. So you would want to assess pain level on a standard scale, 0 to 10, 0 being no pain and 10 being the worst pain you ever had before, during, and after the procedures. Assessing muscle strength and gait before, during, and after Tai Chi as well, since it helps with muscle strength. Assess symptoms related to disease or illness being treated with traditional Chinese medicine before, during, and after therapy. Compare benefits of traditional Chinese medicine therapy with any adverse effects or side effects. Assess for any interactions between traditional Chinese medicine and Western medicine therapies.